Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Your kidneys perform several critical functions. They clean your blood and support important bodily functions. When your kidneys cannot perform these functions, treatment is needed. Whether you know someone with kidney disease or have been recently diagnosed yourself, this show is for you. I'm your host, Janet Whitmoyer. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I would like to welcome our first guests who come from St. Peter's Hospital, Dr. Rob LeClaire, who specializes in nephrology, and Alice Luer, a dialysis unit nurse who is also the home therapy nurse. Thank you both for coming. I'd like to start with you first, Dr. LeClaire. We hear often that nearly 1 in 3 people with diabetes and 1 in 5 people with high blood pressure have chronic kidney disease. Can you start off by telling us a little bit more about what chronic kidney disease really is?
Well, chronic kidney disease is a condition where your kidneys do not clear the blood as effectively as they should. And there's various different levels of kidney dysfunction one can have. We talk about stages or classifications of CKD, chronic kidney disease, stages 1 through 5, 5 being the worst dysfunction that the kidneys may have. Whether with kidney disease, whether you're going to have progressive loss of kidney function over time, it depends on the type of disease. So some people will have some degree of kidney dysfunction where their kidneys are not clearing the blood effectively, and that may not get worse. And then other people, there may be progression, and those are the people we're concerned about, particularly people with diabetes.
Okay. What if a person has untreated end-stage kidney disease? What can happen to them?
Well, if it's untreated kidney failure, which is not as common as kidney disease, fortunately, those individuals, if they're untreated, can die from kidney failure. And that's our biggest concern, is that someone could pass away from kidney failure itself. Kidney disease, on the other hand, they are at risk for other complications, such as cardiovascular complications, such as stroke or heart attacks. They're at a higher risk than other individuals who do not have kidney disease. But the biggest concern with kidney disease is that some people who have kidney disease could have progression to the point where their kidneys do fail.
Okay. So there's obviously some options for people who have kidney disease and end-stage renal disease. What if a person who has end-stage renal disease chooses to do nothing? Is that the problem where they will eventually die?
So you're right, there's various different options people have if their kidneys are failing. And one of them is actually to do nothing at all. That is a choice for the patient, and with a discussion with the physician, usually a nephrologist. And for some people, because of their age, because of other illnesses that they have, they may feel that it's not right for them. If they decide not to do dialysis, people can actually live for quite some time with kidney failure. It just depends on how fast it's progressing. So if it's progressing slowly, some people can actually live for years sometimes with severe kidney failure. Other people may pass away within weeks or months.
Well, that's great information to have. Also, transplants are an option for some people. Can you tell us a little bit about a person who would choose a kidney transplant? What actually happens with that?
So just to make it very clear, the standard of care for people with kidney failure is transplant.
Okay.
So that is the standard of care, and that means that that's what we should be striving for every patient who has kidney failure. If they are a candidate. So some people have other illnesses that preclude them from to having a kidney transplant. Someone who may have cancer, someone who's very ill from other illnesses, and people who are advanced aged. Some of those people would not be a candidate for transplant, but anyone who's a transplant candidate, you really want to encourage them to go on and have a transplant if possible. If someone decides to go in to have a transplant, you have to be evaluated by a transplant center. We do not have any transplant centers in Montana, but there are fortunately a number of transplant centers in the Northwest area that are very happy to take people from Montana and evaluate them for a transplant and have them transplanted. In fact, from Helena alone, we've had 6 different facilities transplant our patients in the last 3 years.
Wow. And so you work with those facilities out of state to actually get the person set up for the transplant and they come back?
Absolutely.
How long do they usually stay out of state before they can come back?
It's usually about 3 to 4 weeks.
Oh.
And most of it is outpatient.
Okay. So I wanted to also talk a little bit to you, Alice, about the other option for people with renal disease, and that's hemodialysis, or hemo or peritoneal dialysis. Can you tell us a little bit about what happens if a person does decide to do dialysis?
Well, there's several different options for dialysis. A person can choose in-center dialysis, and that is a set schedule. So they either come in on a Monday, Wednesday, Friday, or a Tuesday, Thursday, Saturday at a set time. They go into a dialysis facility, trained staff then manages their dialysis treatment. The other option is a home therapy option, and there's 2 different types of home therapy. They can do either home hemodialysis or home peritoneal dialysis. And the patient and his or her care partner are trained how to manage those treatments at home. Now, obviously, a person that chooses a home therapy has much more flexibility in how they are actually managing that treatment. We give them, we want you to dialyze. For peritoneal dialysis, they dialyze every day. For hemodialysis, they will have a set number of days we want them to dialyze in a week. And they can choose the time that they want to do it. So it works really well for them. Quite often, people that choose home therapies feel a little bit better than those that come in center, because home therapy, since it's more frequent, more closely mimics real kidney function.
Okay, awesome. Great information and great options for people with end-stage renal disease. We'll be back right after the break to talk more with Alice and Dr. LeClaire about end-stage renal disease and more on kidney function. We'll be back right after the break.